This is Millie. Millie has childhood asthma. What is childhood asthma, you ask? Let's find out. Childhood asthma is a condition characterized as a long-term airway inflammation that causes a remodeling of the airway wall. The onset is typically before the age of 5. The people that are most affected by this condition are children that come from low-income households or urban communities, have a family history of allergic diseases, have a mother who smokes, are obese, or are from African American descent. It is more common in boys than girls older than 9 years old. This chart shows the prevalence of childhood asthma. As you can see, there is an increased prevalence in childhood asthma in people of African American descent. What factors increase your risk for getting childhood asthma? Some risk factors include premature birth, lower birth rate with increased weight gain, exposure to air pollution, certain genetic genotypes, fast food consumption, a diet without enough fruits and vegetables, infant viral respiratory infections, and a vitamin D deficiency. So how do you know if you have childhood asthma? If you are coughing, wheezing, are short of breath, have a tight chest, have limitations of activities, or are experiencing color changes in your skin, you should schedule an appointment with your doctor, as a timely diagnosis is important for treatment and symptoms are difficult to manage otherwise. How does the doctor know if you have asthma? Doctors can diagnose childhood asthma from the description of your symptoms and the results of a spirometer test. The doctor will give you the spirometer and tell you to blow into it. Based on the force of your breath and the amount of air you exhale, the doctor can tell if you have asthma. Okay, so now your doctor has determined that you have asthma, but where do you go from here? Luckily, there are options to manage this condition well. Doctors may prescribe you an inhaled corticosteroid as they want to manage the asthma with the safest and most effective treatment using the lowest dose of medication. 2 puffs twice a day is the typical dose, and it is put in a pressurized metered dose inhaler with a spacer in order to get the medication to the lungs. Children under the age of 3 may use a face mask, and adolescents can use a dry powder device instead of an inhaler to make sure they take it. ICS is the most effective treatment for controlling asthma, and if it is taken properly, it is perfectly safe to use. Some people may have problems controlling their asthma. Some common reasons for poor asthma control are failure to take prevention treatment regularly as prescribed, poor inhaler technique, ongoing exposure to trigger factors, and poor levels of treatment for current disease severity. How can doctors tell if you're controlling your asthma? Thankfully, there's a test for this. It's called the Asthma Control Test, and it asks questions about symptoms and control. This can help tailor the treatment to the patient and helps the doctors find the best treatment. The best way to reduce future asthma attacks is to follow your prescribed medication and control your asthma. Who else, besides doctors, can help someone with asthma? Besides your doctors, there are many healthcare professionals who can help provide the best treatment, including physical therapists. Physical therapists are really helpful, especially when it comes to education. How can they educate children with asthma? Let's give an example using our good friend Millie. Millie has a common complication of asthma called allergic rhinitis. Allergic rhinitis makes it hard for her to breathe out of her nose, so she breathes through her mouth instead. Because she breathes through her mouth, a lot of unwanted particles are getting into Millie's body that the nose usually filters out. Physical therapists are trained to be able to teach their patients how to breathe normally again and work towards getting them back to the way they were functioning before. The physical therapist can educate Millie on proper breathing techniques. This can reduce exercise-induced asthma, which is great for Millie because she really likes to play soccer. The physical therapist can also teach Millie's parents the techniques Millie is learning so they can be equipped to help her and make sure she is on track. Soon, Millie can get back to playing soccer. In fact, playing soccer would help shrink the effects of the exercise-induced asthma even further and reduce the dose of medications Millie needs to take. So what can you take away from this video? If you have any symptoms, go see your doctor as soon as possible. Control your asthma by taking your medication. Physical therapists can be a great help, and exercise is great.
Created using Powtoon.